Hello, Dr. Pelto here. Let's go over a few of the questions that we had this week in the office and on the YouTube page here. So once again, you can all ask your questions. There's a little link underneath. We're going to go over today just kind of some people that are coming in with calluses that become actually blisters or ulcers. One person that wanted to remove their own wart, a question about ultrasound gel with shockwave therapy, and as well some nail trauma questions. So let's get into it. Basically, there was a patient that posted something. He removed his own wart. This was in Portuguese because I put a video in there about me removing one. He said I did it myself. Very rarely do I see people that think they can remove it, but to get the whole thing out without numbing is quite hard. If you've found that you've done it on your own, that's great. Not all that common. There are a lot of other treatments you can do though on your own before you see a doctor. But sometimes if there's an isolated wart, you just remove it. Usually you have to numb it up though to get deep enough. Okay, that's my thought. Toenail injury question. So I put two examples here. One is kind of going lengthwise and the other one is going widthwise. He said my toenail was clipped off by an object that fell on it across the middle of the big toe. It was a perfect break across the toenail and it stopped exactly before the nail bed. Will I need to do anything? So the nail bed is right here. And so I think what he meant is it broke this way. So broke lengthwise down and stopped at the bed. You don't need to do anything. Some people recommend putting a little bit of super glue on it so it doesn't continue to split. But basically you could also just trim off that portion if it's bothering you, but something so it doesn't keep splitting down there. But most traumas, they'll heal by themselves as they grow out, either this one or this one. That's an example. Next, a patient asked, so without ultrasound gel, the treatment of shockwave is ineffective. Yes, you have to have a coupling gel. Basically, it's a gel that allows the shockwaves to penetrate into the tissue. Initially when it was started, it was done on kidney stones, and breaking them up, you had to be in water to shoot those sound waves in there. It needs something to couple it to go in. So yes, you do need ultrasound gel for most shockwave therapies, and we use that on a lot of different things. So I put some information underneath this video on these topics that we're talking about if you want to learn more. Here's an example of someone that came in, they had an infection. You can see there was a pussy abscess here, and there's like cellulitis. So this patient had to be on antibiotics. It was debrided down. And this is the problem with people that can't come in to see us because of COVID and things like that. It developed an ulcer, but this patient was treated. She also has a pretty big bunion that needs to be fixed, and this toe is a little bit up and dislocated with a hammer toe. Wanted to show something. This is a question that everyone asks when we look at x-rays. They always ask, well, what is this little line right here that kind of looks like a snake? What this is hardening of the arteries. It's called mockingbird calcinosis. And so everyone asks me about this when they look at this. This is actually hardening of the arteries. It's called mockingbird calcinosis. And it's right here. And this is something that can happen as people get older, the hardening of the arteries. This patient also has some arthritis in the big toe joint and a lot of other things kind of going on as well. But that's the question everyone always asks. They ask that, and they also ask, what are these two little bones here? These are called sesamoid bones. Everyone has that. Here's kind of a subtle change. You might not even be able to see it, but so I enlarged the picture. But if you look here, if you count first, second, and third, this patient came in, and you see this little step off right here? So that's a fracture this patient had. It's very subtle, subtly seen. So I blew it up, and you can kind of see this kind of how it steps off right here in that little slight twist. That's called, this was a fracture. This patient got injured, and we are treating it. And in fresh fractures, we are using shockwave. This patient really has to travel, has to get going faster. So a typical fracture takes 6 to 8 weeks to heal. If you want to speed it up, you stay off it, you stay in a walking boot, and you can also do some shockwave therapy to speed that up. So that's it for this session of Healthy Living. I hope you found it helpful. If you have any other questions, you can ask a question below or just put it in one of my videos that you're watching, and I will try to answer it the following week. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.